Yeah, I got one right there. I got my own.
All right. Welcome to the Health, Hospitals, and Social Service Committee on Tuesday, September 7th. We don't have a long agenda, but we also have Mr. Sharp. As I noted a few minutes ago, I just wanted to get a quick update for in regards to COVID-19 and where we are, and then give the committee some time to ask questions to the health department in regards to their COVID preparedness. Mr. Sharp?
You'll do that first?
Yeah, we can do that first.
Right. So we've had some technical issues, and today's report's not out yet. So this is from Friday. So at that point, we had 5,607 active cases, which is a lot. That's about as many as we've had at any point. The positivity rate has been pretty high consistently in the tests. This one you might find interesting. So for the monthly average age, the number of the deaths in a given month, the average age, until it peaked in December at 77 years. And that was, and the lowest it had been prior to that was 67.6 years old. It's been lower than that for the last 4 consecutive months, as low as 59 years of age, as average death. You guys have all seen this. We're bumping back up over here pretty seriously. The testing has gone up. The second testing site opened today at a parking lot that HCA owns at the corner of the 31st Avenue connector in Charlotte, right there, not too far from where the health department is. They opened for business today. So that'll help with the testing. Our positive rate is up to 15.3% of those tested are showing up positive. The 14-day moving average is 478 new cases per day, which is where it was it was on the way down from the peak in early January. The number of new COVID infections per 7-day moving average for the last month is 513 a day. That's high. The 7-day positive rate, 14.6, 14 days, 14.4. That's pretty consistent. The average cases per 100,000 is 73.9, which is way up. Now, it has moderated very slightly, but 1 or 2 days it hasn't been paying very much, so we'll have to wait and see how that goes. Tests. And then on the vaccination front, they've ticked up a little bit since late July. Still 1,860 some odd a day, roughly 1,800 a day. And so we've got 58.5 of Davidson County residents, and that's everybody. That's not just eligible people, that's everybody in the county. Have had at least one dose, but I'll tell you this, that the COVID original one dose provided something on the order of 80% protection. It does not for the Delta variant. The first dose provides more like 30% coverage. So you really everybody needs to really get that second dose. And 52.1% have done that. They're fully vaccinated. As you know, there's a lot of conversation about third shots and boosters. The ones approved so far are for immunocompromised folks. Those are being given now. Right, as yet, there is not approval for those who got their 2-shot series, or any series, Johnson & Johnson or the 2-shot series, to get a booster. There's some talk about doing it at 6 months or 8 months, but as yet, the FDA has not said, yes, go and do that. The administration is pushing them to do it, but it's not fully cleared to do that yet. I'm curious about that because I'm at 9 months right now. So I'm ready to go get mine. My wife tells me to go lie to them. That's what I got, Mr. Chairman. If there's any questions, I'll try to answer them.
On the third shot, do we know, are we going to receive a notice that we're eligible to go, or do we just call our doctor and say it's been 8 months, 9 months, can we come in and get one, or how do?
Yeah, once they're approved by the FDA, if you've got your second dose say January 30th. So 8 months from then, you'll be able to go anywhere. You'll be able to go to Walgreens.
So we
or
don't need to be notified we're on a list, we just need to go and show our
That's
card?
correct. Yeah, the vaccine is generally very available. It's at the grocery stores and drugstores and the health department and all that. We've
Okay.
got a clinic at Lentz if you need to come there. Just come on.
If I may say, I know someone who has gone and just shown up, they have pre-existing issues, they've gone and just shown up at a pharmacy and been able to get their booster. So I mean, that's somebody with pre-existing conditions, they may have, I'm not sure how they got it, but they got it, and it's available out there once
So we don't
somebody's
have to go
ever-
back to the place we got our first shot?
No, but you do need to get the same vaccine.
Right, yeah,
Yeah.
okay.
So, and if you have any questions about where to find it, the vaccines.org will tell you where it's available. They'll tell you which one they have, whether you have to have an appointment or not.
Okay.
It's a really useful tool.
So, yeah, for everyone walking, we're not discussing any bills yet, or resolutions. We are just getting a COVID-19 update from the health department. So, Mr. Sharp's taking any questions that you may have. Councilmember Benedict.
Thank you, Chair. So, 3 weeks ago, when we were here, we had a room full, and we appointed Dr. Wright as the director, and I'm very glad about that. I think he's a good choice for us. At the same time, when he and Dr. Jahangir were here, we asked about masking. Of course, they were both wearing masks, as all of us were, because we're in a metro building. I've caught a lot of flack in the past 3 weeks in regards to masking, and that we should have a mask mandate. I think in the past 24 to 48 hours, many of us on council have received many, many messages from people about instituting a mask mandate. I appreciate the sponsor of the bill that is on the floor tonight, and in regards to mandating a mask requirement throughout Davidson County. I guess my question is, and I'm not sure that you can answer this or not, Tom, so maybe this is just for the record, but 3 weeks ago we heard that the vaccine is the main solution and masking is Now, that's me paraphrasing, right? That's not exactly what was said, but certainly the vaccine is the number one absolute way that we should be working on things. But I believe it should be an and I don't think we heard that 3 weeks ago. Is the health department's, my question is the health department's position today that it should be an and rather than just the vaccine? Because what I heard 3 weeks ago was just the vaccine. Am I incorrect about that?
No, that is still the position. I've talked to Dr. Wright and Dr. Jahangir both about this. Dr. Jay was here for the council hearing last Thursday, I think, and was asked that question. And Dr. Wright concurs completely that it's not, understand the impetus for it, I really do, understand the desire, except for the kids in school that are not eligible to get a vaccination, where then thank goodness MMPS is requiring masks for those, for everybody, but particularly protect those kids and the teachers. It's just not, we don't think it's the best way to go for a variety of reasons right now.
Could you, Chair, if you'll indulge me, may you explain the variety of reasons, Tom?
I think the main one is, and this is speculation on my part, just from having been through these things, that it could have very negative outcomes for the health department politically at the state level, that we might go away.
So the variety of reasons can't be determined definitively tonight. Is that what I heard you say? In other words, you think that that may be the case, but we don't know if that's the case or not. We just
We do not
suspect that the state might preempt in some regard.
What I do know is that the letter the Speaker of the House sent to the governor when he requested a special session included eliminating the metro health departments. There are 6 of them. That was one of the things he wanted on the agenda for the special session, to further restrict. And I would tell you that I really don't believe that the state would fund the health department here anywhere near the level that you guys have traditionally funded it. I think you would have a truncated, very less of a health department if that would be the case.
Thank you, Chair.
Thank you. Any additional questions for Mr. Sharp in regards to COVID-19?
Are
Councilman
we
Bullock?
talking about,
We're not just yet. It's just an open conversation in regards to COVID-19. So over the last couple of months, as we've seen the increase in the Delta variant and cases, I've asked Mr. Sharp just to provide a brief COVID-19 update and answer any questions that council members have received from their constituents before we get too
Well,
deep
while
into
we're
it.
on the
If I may,
topic,
Chair, I did not mean to go down that rabbit hole that a bill on the agenda is a part of. I was just asking questions that led to that.
So
Thank
if
you,
it,
Chair.
if it is for the bill, I'll ask to wait for that resolution.
Okay.
Is it in regards to that resolution? Any additional questions, and we can get started to this, and we can get to those questions as well. All right, thank you. All right, so resolution RS 2021-1119 by Porterfield accepts a grant from Tennessee Department of Health to Metro Board of Health to provide supplemental foods, nutrition, education, and breastfeeding promotion to eligible persons to promote good health.
motion?
Second.
It's been properly moved and seconded. Any discussion?
That's the Women, Infant, and Children, known as WIC grant that comes to us every so often.
Any additional discussion? All in favor?
Aye.
Aye.
Any against? All right. RS 2021-1120 by Porterfield accepts a grant from the Tennessee Department of Human Services to the Metro Board of Health to conduct immunization record audits for child care centers, drop-in centers, and group child care homes to ensure the safety and well-being of children and families in Tennessee.
Motion.
Second.
Been motion properly moved.
So the
Sharp.
DHS licenses the child care centers, and the state law requires that children have certain vaccinations. We audit the books to make sure that they are in fact getting their vaccinations. That's what that's for.
Thank you. Any additional discussion? All in favor?
Aye.
Aye.
Motion carries. RS 2021-1121 by Porterfield approves a contract for services between the Metro Board of Health and Neighborhood Health Incorporated to provide homeless individuals with medical services at 2 or more clinics in or near downtown Nashville. Have a motion?
Motion?
Second.
It's been motioned and seconded. Mr. Sharp?
So the charter requires the health department to provide some health care for homeless folks. We used to run the clinic, the health department ran it, but for years now, I'm not sure when all it changed, but it's been 20 years, probably more. That morphed into a grant directly to,
Neighborhood Health?
which was then United Neighborhoods, now Neighborhood Health, and they, for the clinic, to help them fund that clinic down by the mission.
Thank you. Any additional discussion?
I have a question.
Go ahead.
Yeah, I know this says in or near downtown, and obviously we have homeless people throughout the county. Is there any kind of funding or anything to help those who live beyond walking distance to downtown to get
Well,
there?
we give Neighborhood Health, I think it's $340,000, something like that for this. They've got 9 clinics in Nashville scattered around in places, mostly in traditionally underserved areas. So that's not the only place folks can get help.
Okay, when it said in or near downtown, I was
Basically,
thinking,
we're pitching in a
my
little bit of
Berkeley
money for their
Park
operation.
is, you know,
Right.
17 miles from downtown. It has about 80 people living there, so that's why I was wondering. Okay.
Any additional discussion? So this is RS 2021-1121. All in favor?
Aye.
Any against? RS 2021-1122 by Porterfield approves a grant contract between the Metro Board of Health and the Mental Health Cooperative to provide expertise and staff in emergency behavioral health care to support the launch and pilot year of the Metro Nashville Police Department co-response model, Nashville Partners in Care.
Motion?
Second.
All right, it's been motion properly second. Any discussion, Mr. Sharp?
So this is a new program that has, as you guys know, it's been a long-standing problem that a lot of behavioral health issues, a lot of mental health issues have ended up in the jail because there wasn't really a better way to treat them. And that was not good for them, wasn't good for the jail. This pilot is based in the North and Hermitage precincts. And I just talked to the Commander McLean from North, and he's very positive about the way it's going. They've started doing it a few months ago. They have a mental health professional ride along with the police when they get calls that are thought to be behavioral and mental health issues. And they've had 847 calls to date, 429 of which would meet the criteria for a crisis intervention, which is what they call the police training for the policemen are also trained. In those 429 incidents, only 4.2 of them have led to an arrest. So the idea is to, if they really need some kind of help beyond just calming down, they can take them to the mental health co-op. We've been funding a program there for some years to help facilitate the dropping off by the police to the mental health co-op. It used to take, sometimes they had to stay because there wasn't security otherwise. When they expanded that facility, we pay them, Metro pays them $400,000 and some odd a year to help run the drop-off program. That they've got that down to like 10 minutes now, instead of sometimes it was 2 or 3 shifts before they could get the person properly situated. So there's a lot of work going on in this area to try to, if somebody shows up with kidney failure, you don't send them to jail. I mean, it's not a medical facility. So there's a lot of work going on in that, and this is the latest effort.
Thank you, Ms. Sharp. There's an amendment to this bill. Councilmember Porterfield, Councilmember Toombs has this amendment. I suppose that it came through finance, budget and finance.
Yes, the amendment was added and it passed. It was to add the grant budget that was left off. It was left off of the original legislation.
Would you like to sign on this amendment, or have you?
Yes, please.
Thank you. So there's an amendment, and it's to add the budgeting information to.
Move the amendment?
Yes.
Second.
Thank you. We'll move the movement. It's been properly seconded to move the amendment, and that amendment will then, again, add budgeting information to RS 2021-1122 in regards to the Nashville Partners in Care model. All in favor of the amendment?
Aye.
All right. Any opposed? Thank you. Any further discussion on the Partners in Care?
So are there health workers that are like on call? Because obviously they're not going to be needed for a full shift.
Yeah,
So is it like they're on call and
They
you?
work day and evening shifts at those 2 precincts.
Okay, so they just show up like it's just their work shift?
Yes.
Okay.
And this is a pilot just in those 2 precincts, and hopefully, if it's as effective as we hope it will be, we could try to expand that in the future.
Okay.
And those 2 precincts were chosen because they got the most
Most
calls of
activity.
that type.
Any additional information? All right. Great, thank you. So RS 2021-1122 by Porterfield, and it's been amended by Toombs and Porterfield. All in favor?
Aye.
Any against? All right. RS 2021-1123 by Stiles, Allen, Gamble, and Hurt urges the Metro Public Health Department Chief Medical Director to require masks be worn by all individuals in public indoor spaces.
Motion?
Second.
It's been motioned and seconded. Councilmember Stiles.
Thank you very much, Chair. So, back again, this time properly filed so that we can actually have some good conversation about it. In the last 2 weeks, Delta continues to ravage the entire country. Multiple cities, the entire state of Illinois, Shelby County instituted indoor mask mandates since our last meeting. I think it is ridiculous, as we are literally living in life or death moments, to sit and worry about, ooh, what's the state gonna do to us when people are dying? They are on ventilators. They don't have to be. We cannot force people to get vaccinations. We cannot. But this body does have the ability to put an ordinance in place, and right now we're dealing with the resolution, calling on the health department to do the right thing, save our residents. To Councilmember Benedict's point, this is not an either-or situation, this is and. If we cannot get people to go and get vaccinated, then we all need to be inconvenienced and wear a mask so that we can get these numbers down. Every number that you provided for us is horrible. And having asked for these numbers just today, so you were all able to hear them, since we didn't get them on Friday, I can tell you that the vaccination rate, the chart that you will be receiving, shows that we are now at the same level we were when vaccinations first rolled out in January. There's a huge spike at the end of March, and then it just dwindles down. This body should not be impotent. We are dealing with lives. We need to take that into consideration. I understand that the state is a fearful situation, but we also need to send a message to our constituents that we care about their well-being. And sitting here and being fearful and waiting to see what the state is going to do is not the answer. And I think we need to collectively agree that the health department needs to step up while our lovely medical director has COVID himself traveling in the midst of a Delta surge to another country. I mean, that is just so ridiculous. And missed a meeting. Missed a meeting, didn't communicate with anyone. For me, that affects my trust. So at this point, I feel like we do need to step in because the priority is not people right now, it's politics. And that is horrible in the midst of a pandemic. So I ask all of you to please vote yes. The CDC has asked everyone, vaccinated or unvaccinated, to wear masks. We need to do the same. We cannot also be fearful of enforcement. That is another problem. Last year we talked about enforcement as well and claimed that was the reason why we didn't institute a mask mandate. But when our cases got high enough, we suddenly had a mask mandate. We have to stop reacting all the time and have some foresight. Let's stave this off. Our numbers are getting worse, and children are now being affected. The ICU at Vandy Children's is full. We are in worse shape right now than we were last year this same time. And the cases from Labor Day, they haven't even begun to come in. So let us please put our constituents first. And this garbage about politics has to wait. Thank you, Chair.
Thank you, Councilmember Stiles. Councilmember Pulley had a question earlier, so I'll go straight to you.
I've got a couple of questions for Mr. Sharp. Mr. Sharp, in 2020, the city did issue a mask mandate. And could you, as a matter of review, discuss with us procedurally how that was instituted and the rationale for instituting that policy by way of a reminder?
That was done by the Director of Health. It was a Director Health order. It was because the numbers were going up. The biggest issue with that was, initially at least, it was left to the health department to enforce it. And we really just don't have the wherewithal to do that. Eventually, the mayor's office said, well, no, this is applicable to everything. This has the force of law, and pulled a group of everybody together, but most particularly the police department, and really drummed in that needed to be enforced by everybody. And it was maintained through the worst of the winter time and then the spring, and then it went away. I'm trying to remember when there was a trigger for that. I think it might have been it may have been at the state level when the governor's executive order no longer. There was some change there, I believe. But anyway,
The infection rate dropped below 7%, I think, was the trigger for us to remove the mask mandate.
It dropped considerably, and there was, we wanted to, I'm trying to remember, it's been such a blur. So the last order that restricted, capacities and times and that kind of thing went away right around the end of May. And there was some discussion about trying to keep the mask order in place at that time. And we were for that, and I'm trying to remember there was a trigger that made it where we couldn't do it the way we had done it, and so we let it go.
Okay, I think you've satisfactorily answered my question. Has the health department considered doing another mask mandate, given the figures that you've seen and the spike in the cases and hospitalizations and so forth?
So, I really do understand the question, because they are going up. The way I'll channel the board chairman at this point. So, the reason last year we had all of those things, we had the restricted hours and restricted gathering sizes, the limitations on businesses and all kinds of things, is that there was no medical intervention available. We didn't have any other tools to use. So the public health response was to try to just keep people apart as best we were able, because it was all we had to use. When the vaccine is universally available like it is, there is a medical intervention that's available for use. And traditionally, those other public health responses go away and defer the medical intervention, and that's where we are now. I understand that the cases are going up. I haven't talked to Gil since he got back, but I'll talk to him, and he knows about this. You know, certainly, he's keeping an eye on things. We can't do it the way we did it before, I don't think, because the legislature has changed the law to limit the Board of Health's ability to do things. But I don't know that there isn't still some way to do it. So we'll probably have to test that in court ultimately, I think. I think Memphis is in court now over their mask mandate. At any rate, it doesn't mean we wouldn't try, but I'll talk to him and see. He's certainly aware of the situation. But he and Alex both have said consistently that the intervention at this point is the vaccine.
So with that said, being, as the health department has a viable option with the vaccine, seeing that our vaccine rates have not really significantly changed recently, would the health department consider a mask mandate if we still keep seeing our cases go up? Or is the fact that we have vaccines given a medical alternative for people basically going to preclude you from ever really going down a mask mandate path again?
I don't think it would preclude it. It would mitigate against it to some extent, but I don't think it would preclude it. No.
Okay, so what you're saying is you would consider this moving forward?
I mean, yes, everything remains in play, you know, but right now that is not the preferred path.
Okay, that's my questions.
Thank you, Councilman Hurt.
So, the vaccinations are not mandated,
That's
right?
correct.
But I think the number is like 92% of those who are dying are unvaccinated. Is that correct?
Yes.
'Cause see, I believe that prevention is always the best solution. And has it been proven that masks do help?
Yes.
So, I'm kind of like Councilmember Stiles. I mean, it's common sense. And I realize that common sense is not necessarily common these days. I don't think that it is supposed to be left up in the hands of politicians, and it should be left up in the hands of health experts. And as stated earlier, the CDC are our health experts, and they believe that mask mandates should be put in place. And I thank you so much for bringing this back in a resolution where we're encouraging the health department to step up and insert the mask mandates. Because it's really interesting to me that those who are saying that people have an option to wear masks all are vaccinated. And it just seems to be hypocritical in a lot of ways and at the hands of people still dying. So I fully support the resolution, and I encourage our colleagues to do the same.
Councilman Benedict.
Thank you, Chair. So I was watching the town hall from last week that the administration put together, and I'm reminded of what Dr. Hildreth said in that, which is that we have a lack, instead of us making this political, let's leave it to the scientists, and let's leave the politics out of it, and let's be leaders. So we are all politicians, right? Public officials, right? We can lead on this, but one of the things he talked about was leading all of us, every one of us, every neighbor of mine, every constituent in the neighborhood, all of us do that. And I'm not one to talk much about my religion, but I think it's important right now to talk about what it means to care for another human being, what it means to be Christ-like, what it means to put a cloth on my face in order to protect somebody else, to put them ahead of myself. And so I view that as leadership. I view the health department saying to people, you need to do this, we're going to implement it, you're going to be penalized if you don't do it. because we are taking care of one another. Yes, there's a medical intervention. Yes, there's a vaccination. But if most of our state, we had the state, not Nashville specifically, but the state last year was number 2, I believe, in the world
That's this week.
Woo-hoo.
this
If
week,
we
rather.
were a small country.
In the world, if we were a small country, we were at the top. I keep getting messages from people out of state who I've known for years. How are you doing there? How are you making it? We have got to lead on this. We have got to say to one another, let's do what's right. It's inconvenient. It stinks. We're fatigued. We need to pass this resolution. The health department needs to put this back in place until we get this under control, and we are not there yet. We have got to get to a herd immunity with vaccines, but I encourage all of my colleagues, and I encourage most importantly through this resolution, the health department put a mandate back in place so that we save each other's lives. Thank you, Chair.
Councilmember Hall, and then Councilmember Porterfield after that.
So a couple of weeks ago when we were talking about this, I had mentioned we needed, because we knew it was gonna be political, cover, so to speak, right? If you got one of the two, whether it be legal or medical, to say we had the authority to do this, because we get preempted all the time on stuff. And it's not just preemption, sometimes it's preemption with punishment. The state will make an example in a variety of ways when you do something knowing they have a different opinion of it. So some of the things that we can look at that to accomplish the same thing, we know we're gonna get preempted. It's not even a guess. We will. We know we don't have the legal authority, even if the health department does a mandate, nobody's gonna enforce it. The administration and MPD are not gonna enforce a mandate. We can do it, and they'll tell you, go down the hallway, ask one of them, it's not gonna happen. So how can you backdoor that conversation? Let's look at going back on the capacity side of this. Because if you want people to wear a mask, give them the option. If you don't wear a mask, we'll go back to cutting restaurant space and events and things like that, size down. I bet they choose the mask to keep going out. I bet they choose the mask to still be able to go out to eat or go to a ball game or a concert. And you won't have to rely upon Bridgestone or somebody to say, show me your card and you can come to this Dave Chappelle show. Because, man, I want to go see Dave Chappelle. And then let's look at the conversation around kids who are getting really hammered by the variant, right? So what does it take to start the conversation around, look at all the things that children are vaccinated for and is required to be in school? Well, right now, children 12 and up can be vaccinated. Are we having the conversation about requiring that children 12 and up be vaccinated to be in school? Those are different ways that we can approach to accomplish the same thing, to create some of that pressure, right, on an administration, on the health department, on everybody collectively to come up and say, okay, you don't want to wear a mask, fine. These are the other things that are in place. Because as we even heard in here today, this time last year, when you didn't have the vaccine, we used all of those tools to encourage people to be safer. Once the vaccine came, all of it went away. Why? Bring those other things back, and then let's approach the conversation that way. So now you've got some options and alternatives that also create pressure and make more folks want to say, okay, now somebody's just not trying to make me wear a mask. If I want to go here, got to wear a mask. If my kid's over 12 and the vaccine's available to them, they got to have it to go to school. It creates pressure really fast in a lot of ways on a lot of people to step up. And it takes it all off of us.
Well, they can listen to Phil Valentine. He told us, he was a voice and a true example.
I mean, we've got some options, right? This is a good example of where we take feelings out of it and we work smarter, not harder. Schools, making kids above 12 since they have it, let's have the conversation about it being required. Add it to that immunization chart. We just got through talking about.
Well, I think we did have a resolution last time that was filed by Rosenberg and Mendez, I think, for the schools, for that.
Right, that's what I'm saying. We've got some alternatives. So between that between going back to limiting capacity and different things, guys, I think we can accomplish this
And this should be one
without
of
just,
them.
right? So it's gotta be a layered, effort.
Councilman Porterfield, do you still have a question? Let's see.
I need a clarification, it's okay.
Yes, go ahead.
The question was actually for Councilmember Styles, if I may, address Councilmember Styles. What was Tennessee number 2 for?
So if we were a small country, we would have been number 2 in the world for cases last week, when we were number 1 in the nation. But if you took that and just made us our own country, we would be number 2.
And that was last week, the state of Tennessee?
Yes.
Okay, thank you.
Councilman Hauser had a question.
Yeah,
She said again.
No,
as I keep listening to all the arguments that folks have, some of you are maybe a little young to remember pre-seatbelt, but there are other of us here that seatbelts weren't required when we were kids, and car seats weren't required when we were kids. And kids were allowed to sleep in the back window of cars as you're going down the highway. You don't see any of that now. Wearing a seatbelt is more constricting than wearing a mask. So I think that, back to your saying we need to step up and be adults. I think for those adults that say that's a restriction of my personal freedom, it's like, do you stop at stop signs? Do you wear a seatbelt? You do all those things. And we just accept that as normal life. To me, wearing a mask, as Councilman Lady Benedict said, it's the responsible, caring thing to do, but it's also the adult thing to do. You can be a little baby 2-year-old kicking your feet on the floor, or you can be an adult and step up and be an adult. And I think wearing a mask is just simply being an adult, accepting responsibilities that you live in this world. That's just my thing.
Thank you, Councilman Hauser. Councilmember Welsh.
Thank you, Mr. Chair. I agree with many of the things that Councilmember Hauser said, but I think the difference between then and now is that was an effort that was fully supported from all branches of the government and all throughout the medical community. We can't do any of these things in a vacuum. A mask mandate without enforcement is nothing. And the anger and vitriol that comes with this idea of masks now is way over the top, and really more than we can address. As we've seen, obviously, there's a lot of violence behind some of the rhetoric that we hear from people who are very much anti-mask. But I also don't, to Councilmember Stiles' point about this being political, I don't think it's political to be concerned what the state might do to our health department. That could have very, very long-term health, cause long-term problems. That it's one of those, it's the unintended consequences of something that we're doing, right? We don't have the power to enforce. People aren't gonna do it. It's kind of an empty threat. And then we have the state come in and perhaps slash our health department so that when the next pandemic comes, and we know that it will, we don't have the power to do any interventions to try to stop it because they have effectively neutered us with that ability. I think that is a legitimate concern and something that we have to think about, given what we've seen this state is willing to do actively to undermine public health. And they are actively undermining public health, and I don't think they would think twice about cutting our health department and tying our hands as we move forward and try to serve the people of this community and keep them healthy and focused on well-being. So I think it's very important that we look at those things. And I can't support this because this is not what the medical professionals here say that they want right now. It's very difficult, as we know, to try to convince people who are anti-mask why they should not be anti-mask. When you tell them, look, there was no flu last year. Why? Because a mask stops, the germs coming out. Why do surgeons wear masks? Why do surgeons mask up and stuff? So you don't spread germs together. We can't convince people of that. We haven't found the magic thing to convince people of that. So I don't think this is going to have the intended effect, and that's why I can't support it.
I don't necessarily think that it's about having that intended effect, but I am not going to stand here because if we don't do it, then it's almost like it's a choice. Silence is consent, and we need to force them to make a stand. And if they're going to make the stand that they are going to allow for people to continue to transmit this virus, then I'd rather it be on them and not on me.
But then who's going to force them to do it?
They can do, I don't know, and I frankly, I don't care, but I know for me, I cannot sit back and continue to allow it. And last time, I was about making sure that we did this properly through the council and not urgently try to push it that way. But when you take the time and go back and do things the proper way, then I think that is the respectful thing for us to do. And with that, we have to continue to tell them they will say that we agree because we do not force it on our part. So I think we've got to send the message to them and let them, so if there's no pressure, then you don't get any results. Not at all, as far as I'm concerned. And I think it's a shame that we are sitting here when you've got hospitals without enough people, enough rooms for them to be able to care for the sick. Not to mention all of these rural hospitals that have closed over the past 2 years. It is ridiculous. And I look at those who don't have access. The president stood before this entire nation and the world and told people he had COVID. It's real. Absolutely real. And if we don't say anything, it's more ordinary people than it is extraordinary people. And I think the ordinary people must speak up.
So, Councilman Pulley, I'll come back to you. I'm going to go to the sponsor. She has some questions or responses.
Thank you, Chair. So, again, going back to enforcement, this is the same conversation that we had multiple times last year. Who's gonna do it? Contact tracing, we don't have enough people. And as soon as the case numbers went up, we figured it out. The health department recruited people from other departments. This is no different. In the same way, if we continue to see these numbers go up, then another cabal needs to take place, pulling in MNPD and say, hey, guys, we really need you. If you see someone on the street or in a business that's, or not on the street, but rather in a building and they don't have a mask on, then go ahead and write them up. We wasted a lot of time last year, frankly, doing educational moments down on Broadway. Hey guys, wear a mask, instead of saying, hey guy, here's your citation and be done with it. We play pity pat too much. People are dying. We just really don't have time for pity pat. So in terms of enforcement, that's not going to be a reason why I'm not going to act. And we'll figure it out this year. Hopefully we can be smarter, to Councilmember Hall's point, let's work smarter, not harder. Let's realize that numbers are on the rise and we're not doing enough to fix it. And let's figure out who we're going to assign to enforce the mandate. That's it. And I've had businesses in my district tell me they would feel much better if we were the ones instituting this mandate. Because then they can turn around and say, well, it's Davidson County, you guys, so you do have to wear a mask. And then they feel better about it. And I think they feel like they are creating a safety situation for themselves. And quite frankly, that's what we're here for. If we have to provide coverage, then we provide coverage instead of excuses, because we're doing a really great job of that. And it's appalling. Thank you, Chair.
Councilman Pulley?
Yeah, so I just want to briefly comment and state my position on this. First of all, let me say that there's been a lot of really, really good discussion in here, and I do have great respect for the sponsor of this, and I understand her passion behind it, and I understand the numbers, and it makes me a bit conflicted on where to be on the entire mask mandate altogether. I do also have a tremendous amount of respect for Alex Jahangir. I've known him for years, and I really appreciate him stepping up and taking leadership where he has done so with our COVID task force and our health department. And I also, when you talk about injecting politics into this, I have a little bit of a different view than what I've heard today. One of the things that does frustrate me is to throw the word leadership and courage and things around like that, implying that if I don't really adopt your position, I'm not leading or I don't have any courage. So that's a little bit offensive to me to hear those terms thrown around, because Councilmember Welsh makes a good point that does need to be considered throughout this. And I'm frankly torn to the point where I really have such tremendous confidence in our health professionals here. I've heard Mr. Sharp say they would consider this, and I'm much more comfortable putting things like a mask mandate in the hands of health professionals than I am politicians. So for that reason, although I have great respect for my friends on the other side of this issue, I won't be able to support this, and I won't be able to support the ordinance requiring it.
Thank you. Any additional conversation? All right, we're gonna go for a vote. We lost some members, but we're gonna go for a vote. We have 5 in attendance. Councilmember Pulley?
No.
Councilmember Hall?
Yes.
Councilmember Hauser?
Yes.
Councilmember Welsh?
No.
And Councilmember Taylor, I vote yes in the affirmative. Motion carries 3 in favor, 2 against. And that concludes our meeting. Thank you so much.